Hey folks, I got a lot of questions in from potential clients here in Pennsylvania, individuals looking to find out Medicare supplements versus Medicare Advantage plans. So this video is going to be packed full of information that should help you make a determination of whether you should have a supplement or a Medicare Advantage plan. Jan from Bradford County emails in, "Hi Mike, I'm turning 65 in July and I need your help. I'm doing a lot of reading and it's getting me more confused by the day." Now, we hear that all the time here at Hitcho Insurance Agency from our clients. What is Medicare Advantage plans? And is this something I should be considering for myself? What a Medicare Advantage plan is, think of it like this. It's like group insurance. It's private health insurance. And what I mean by that is your health insurance is covered by an insurance company. So if you've been on group insurance your whole life, it's kind of like being on a Medicare Advantage plan. So you're not on the federal plan, the Medicare plan by our government. Medicare is sending money to the insurance carrier to take you over as a client. Why was this created? It was created for a few different reasons. One was so the insurance carriers could have better conversations with your doctors and sort of drive you to get more preventative services done. They even do this today by incentivizing you, maybe with a bonus card or a gift card, to get some basic services done for your healthcare. Over time, if you're taking care of yourself and you're doing preventative measures, if there's no claim the insurance carrier has to make for colon cancer in the future because you've been doing your colonoscopies, they're gonna save money, you're gonna be healthier, you're gonna live longer. Christy from Reading, PA emails in, "Hi Mike, are there different types of Medicare Advantage plans? If so, what are they?" So there are two main types of Medicare Advantage plans. There's one just known as Medicare Advantage, MA, and there's also Medicare Advantage prescription drugs. A Medicare Advantage prescription drug plan simply means that it has your Part D, your prescription drug coverage. If you need to get a medication filled at a pharmacy, you need coverage for that. So that's going to be found in an MAPD, not an MA. An MA plan, just Medicare Advantage only, doesn't have prescription drugs. Well, why is that even around? Why does that exist? Because several reasons. Maybe you're somebody who uses the VA. I don't use the VA, but I am a vet. Thank you for your service if you did serve. Drug coverage would come from the VA if you're going there, and then you don't need extra coverage, so why have that part of your policy? Well, and some people just never picked up prescription drug plan when it started, so your penalty could be really high. So you don't want to have enrollment in a Medicare Advantage prescription drug plan, MAPD, and have some type of penalty that's $50, $60, $70, $80. Those are the two main types of Medicare Advantage plans. Leonard from Philly emailed in with a question. "Hi Mike, I'm getting ready to go on a Medicare in a few months. I've heard I'll need a Medicare supplement. What is that?" A Medicare supplement to Medicare is another way to say it. These are plans that are financial plans. It's not health insurance. If you have original Medicare, you have bills left behind. If you buy a supplement and pay money to the insurance carrier, they should be covering the majority, if not all of those copays and deductibles that are left behind by Medicare. So we here at Hitcho Insurance Agency call it financial insurance. So if you're somebody who's looking for financial insurance, hey, I just want to pay one bill to an insurance carrier and have them cover all the bills that Medicare leaves behind, or most of them, that's a Medicare supplement. That's what that does. Joe from Easton writes in, "Mike, getting ready for Medicare, what are the pros and cons to a Medicare supplement versus a Medicare Advantage plan?" If you have a Medicare Advantage plan, the pros usually are hopefully cost savings, extra insurance coverage for dental and vision, maybe some extra money back for your Medicare Part B premium. So again, it's more of a cost-saving measure, a plan that's going to incentivize you to get your preventative services done. Depending on your area that you live in, you might have an MAPD plan that has no deductible for your drugs. So again, it's about cost savings. Those are the pros. The cons are really in the fine print, sort of the biggest thing that I see, two areas. Number one, if you need a Medicare Part B drug, that's a drug that would be administered by the hospital or your doctor's office. Just think if you had cancer and you need chemo and radiation. Under original Medicare, they cover 80%, you need the 20%. If you had a supplement, that 20% would be covered. On Medicare Advantage plans, none of the plans are covering that 20%. You're responsible for it. There is what's called a max out of pocket on the plan that you elect, so you know that there's a stopgap, that you're not going to have tens of thousands of dollars of bills like original Medicare. So that is a relief, and that might be a very affordable number for you. But if it's not, if it's easier for you to pay $100 to $200 to $300 a month for a supplement, then that might be a better route for you. What's going to drive all of this is where you live. Not only is it different from state to state, but it's different from county to county within that state. Here in Pennsylvania, we are really blessed. We have a lot of insurance carriers offering a lot of plans, specifically PPO plans, so plans that aren't required to have you stay within a network. There's just a lot of companies that are really indigenous to this area. So they're only offering insurance in this area, but they're covering you nationwide, worldwide. And this is also the problem that makes this conversation so complex. Why you're gonna see out there online, Facebook marketing, you're gonna see all these different ads talking about pros for Medicare Advantage versus pros for supplements and cons, and they're really out there because those insurance agents are trying to focus on marketing one type of product to you, when really you should be understanding all your options in the area that you live with an organization that aligns themselves with all the different insurance programs. I hope all this information is really good for you. Take care. Have a great day.